research conference called ASCO 2025 took place in Chicago. Every year, ASCO brings together doctors, researchers, and anyone who wants to learn about the latest discoveries in cancer research. And guess what? There were 2 big breakthroughs for stomach cancer announced at this conference. That's why I made this video. So whether you have stomach cancer yourself, or you have a loved one with stomach cancer, or you just want to know more about recent research advances in stomach cancer, this video is for you. Alright, let's dive into these amazing breakthroughs. Breakthrough No! 1 is a clinical trial called MATTERHORN. Now, if you don't know what a clinical trial is, it's basically like a research study that tests new ways to treat cancer. And this trial tested something really interesting. You see, when we talk about treating stomach cancer, we usually mean surgery to remove the tumor if it can be removed, and then chemotherapy, which we call chemo for short. Chemotherapy uses powerful drugs to kill cancer cells. The problem is sometimes even after surgery and chemotherapy, the cancer can come back. So, researchers have been looking for ways to improve the odds that the cancer won't return. And that's
where this trial comes in.
The MATTERHORN trial looked at adding a type of immunotherapy checkpoint inhibitor called durvalumab to standard chemotherapy before and after surgery.
Now, here's a quick breakdown. First, during surgery, they removed part or all of the stomach and nearby lymph nodes. But here's the twist. Before and after surgery, the patient got a medicine called... This medicine helps the body's own immune system find and fight cancer cells. It does this by blocking something called PD-L1, which some cancer cells use to hide from the immune system.
So, by blocking this hide-and-seek trick, durvalumab helps the immune system recognize and attack the cancer cells.
This type of immunotherapy has worked well for some other cancers, but we didn't know if it would work for stomach cancer until this trial. And guess what they found out? The combination of durvalumab plus standard chemotherapy helped to significantly improve how long it took for the cancer to come back. This is what we call event-free survival. Event means cancer coming back. Free means without cancer. And survival means how long it lasts. So, event-free survival is basically how long it takes before the cancer comes back. In simpler terms, the trial showed that people who got both durvalumab and chemo had a much longer time without the cancer returning compared to those who got chemo alone. That's great news, right? Not only that, but the best part is that this new treatment did not cause any more serious side effects. Surgery remained safe and effective, meaning patients got the benefits of both treatments without any extra harm. This trial was led by top experts from Memorial Sloan Kettering Cancer Center in New York, along with many other centers and researchers across the globe. And the results were so good that they were chosen as one of the top 3 scientific achievements presented at ASCO 2025. That's pretty amazing. Now, while this trial focused on stomach cancer and gastroesophageal junction cancer, the results might also apply to other types of stomach and esophageal cancers. If everything goes smoothly, this combination of durvalumab with standard chemotherapy might become the new standard of care for treating stomach and GEJ cancer worldwide. So for patients, this means that soon you may have the option to add durvalumab to your treatment plan before and after surgery. But remember, this treatment is still being tested and it's not widely available yet. However, the results of this trial are so promising that it won't be long before we know if this new approach becomes the standard of care. Alright. Now let's move on to Breakthrough No. 2. Breakthrough No. 2 is about something called CAR T cell therapy. You may have heard about this on the news or on social media. It's getting a lot of attention because it's like a miracle for some cancers. Let me explain how it works. Normally, our bodies make killer T cells that find and destroy bad stuff, like viruses and cancer cells. But sometimes cancer cells are sneaky, and they hide from the T cells. So, scientists had a brilliant idea. They take T cells from the patient's blood, train them in the lab to recognize cancer cells, and then put the supercharged T cells back into the patient's body. These trained T cells are like special forces that can hunt down and kill cancer cells that other T cells might miss. This whole process is what we call CAR T cell therapy. Now, CAR T cell therapy has already been a huge success for some blood cancers like leukemia and lymphoma. But here's the deal. Solid tumors
Have been a tougher nut to crack.
Until recently, scientists haven't had much success using CAR T cell therapy to treat solid tumors like stomach cancer. But guess what happened at ASCO 2025? Drumroll, please. The first positive results of a CAR T cell therapy success in a solid tumor was presented. Yes, you heard that right. Now, this trial is still going on and they're still collecting data, but this is a big step forward. It shows us that CAR T cell therapy can work for solid tumors. And who knows, it might just be the game changer we've been waiting for in the fight against stomach cancer. Alright, so you might be thinking, okay, that's cool, but what does all this science stuff really mean for me? Well, here's the deal. Science is moving fast, and we're on the brink of some major changes in how we treat stomach cancer. These two breakthroughs at ASCO 2025 show us that we're not just sitting around waiting for a cure. We're working hard to find new and better ways to help patients like you. First off, the MATTERHORN trial tells us that adding immunotherapy, like durvalumab to standard chemo before and after surgery, might become the new standard of care. This could mean better outcomes for a lot of people with stomach cancer. And then there's the breakthrough in CAR T cell therapy. While it's not widely available yet, the success in treating solid tumors gives us hope that this could be a game changer for those with advanced stomach cancer who might not be able to have surgery. Now, I know that can be a lot to take in, so let me break it down for you. Here's what you need to remember. For those who can have surgery, the combination of durvalumab plus standard chemotherapy might be an option soon. And for those who can't have surgery, CAR T cell therapy might be on the horizon. I know that this isn't a cure for stomach cancer yet, but remember, science is moving fast and you're not alone. Talk to your oncologist about these new developments and ask questions like, can adding immunotherapy like durvalumab to my treatment help? Are there trials for CAR T cell therapy that I might be eligible for? Your oncologist will be the best person to answer these questions based on your specific situation. Don't hesitate to ask for clinical trial referrals if you want to explore these options further. And remember, if you need support or have questions about your diagnosis or treatment, reach out to a patient advocacy group. They can connect you with other patients and provide valuable resources. Look, it's always good to get a second opinion too. And there are some really helpful websites like eCancer and Hope for Stomach Cancer that have lots of information. Just keep in mind that every person and every cancer is different.
So what works for one person might not work for another.
But I really hope this video gave you something to talk about with your oncologist. Maybe it sparked some questions, or maybe it gave you a bit more hope. That's what I'm here for. And hey, if you liked this video, hit that like button and share it with others who might find it helpful. Subscribe to stay updated on all things cancer research. Together, we can make a difference. Thanks for watching and take care.